Uganda has 35,511 cumulative confirmed cases of COVID-19 infections as of 31st December 2020. This figure is the second highest in the East African region after Kenya with 94,458 infections. Statistically, in Uganda, 23,368, representing 65.8% of the infected people, are sick and spread across health facilities in the country. 11,878, which is 33.5%, have recovered from the disease. And 265, or 0.8% people have died of the infection. All this in a period of 10 months. In Africa, Uganda ranks the 10th according to the total number of cases registered. Statistics show that for every million of the population, we have 758 total cases, 5 deaths, and 16,084 tests done. Some health experts say there is need to scale up testing for a much better picture of the infection in the country. But how did we get here? According to Corona Scanner, an online dashboard solution which offers real-time coronavirus statistics, Uganda's infection curve is constantly rising. From the time the index case was detected in March 2020 until May, the curve was flat, which is largely attributed to the lockdown. There were only 98 cases between this period. The curve started rising on May 6th when the country registered triple-digit figures in infection rates. This after lifting the stringent measures of the lockdown. From here till to date, the figures have exponentially shot up. The Ministry of Health says this is due to increased community transmission and political campaigns. The campaign season started in November with candidates' nominations. In about 6 months before the election period, the country registered 12,359 confirmed cases. This is equivalent to a 122.6% increase of the infections. Within this period, the country started registering deaths, with its first on July 24th. By the same time, 112 people succumbed to the infection. Between November 1st and December 31st, 2020, 153 more people have died from COVID-19 and 22,768 have contracted the disease. In just 2 months of the election period, infection and death rates have risen by 178.7% and 125.4% respectively. With this insight, the Ministry of Health projects a worse situation because the standard operating procedures have largely been neglected due to fatigue and complacency. The preventive guidelines will also be difficult to implement during the polling days, as earlier seen in the NRM political party primary elections. Walter Mwesije, NTV.